So at virtual ESMO 2020, I presented the results from the ASCENT trial, a randomized phase 3 clinical trial with sacituzumab govitecan versus standard chemotherapy for patients with metastatic triple-negative breast cancer. As a brief background, patients with metastatic triple-negative breast cancer have a poor prognosis. The response rate with standard chemotherapy is in the range of 5 to 10%. The median progression-free survival is in the range of 2 months. And triple-negative breast cancer tends to affect young women and African Americans. So clinically, there's an unmet need for better therapies for patients with metastatic triple-negative breast cancer. We evaluated the efficacy of sacituzumab govitecan. This is a TROP2 antibody drug conjugate. It has an antibody that binds to TROP2, has a hydrolyzable linker, and the toxic payload is SN38, which is a topo-1 isomerase inhibitor. And the idea is that it would bind to tumor cells that express TROP2, and majority of triple-negative breast cancers express TROP2, get internalized and kill the cancer cells while relatively sparing the normal cells. The drug also has a bystander effect by which it can affect cells that have low or no expression of TROP2, and thus it can address tumor heterogeneity or antigen heterogeneity as well. We were involved with the phase 1, phase 2 clinical trial with this agent and saw a response rate of 33% in patients with metastatic triple-negative breast cancer, and this led to accelerated approval of sacituzumab govitecan earlier this year in April of 2020 for patients with metastatic triple-negative breast cancer who had received at least 2 prior lines of therapy. So the ASCENT was the confirmatory phase 3 trial looking at sacituzumab govitecan versus standard chemotherapy in metastatic triple-negative breast cancer who had received at least 2 prior lines of